against urinary tract infection and protection of organic intimate wipes as its treatment, Government of India. And C. Design implementation of IoT technology for accident detection and emergency vehicle tracking, Government of India. Dr. Rajathi ma'am guiding 3 PhD research scholars, 4 MPhil scholars, and she guided 40 postgraduate and 25 undergraduate students. Dr. Rajathi ma'am has presented 25 papers, research papers in national and international conferences. She participated more than 50 workshops, FTB and seminars. She has published 33 national internal journals with high impact fact. She has published 3 books and 6 conference proceedings. Her professional recognition, manager, NAC criterion, third, secretary, Alumni Association, member in Internal Complaints Committee, coordinator, NOVUS, Center of Excellence, member in Institution Innovation Council, member in Women's Forum. Her professional board is life member in Indian Association of Applied Microbiologists, life member in Pharma Research Library, life member in INRES Institute of Researchers, Wayanad, Kerala. Dr. Rajathi ma'am has awarded us Young Researcher Award 2022, Institute of Researcher, Wayanad, Kerala, and international level Vagai Award 2023, Vagai Tamil Sangam. My hearty congratulations to your incredible success, awards, and achievements, dear Rajathi madam. Now, I invite Dr. Rajathi ma'am to deliver her session. Welcome, ma'am. Now the time is yours.
Thank you, ma'am. Thank you for your very good introduction. So I take this opportunity to thank Dr. Sudarshan, Director, and Dr. Rekha, the Coordinator of the Progress Institute. Good morning, students. Today I'm going to deliver this topic, recent developments and research in phytomedicines. Is the screen is, are you able to view the screen now?
No,
Hello?
ma'am.
Is the screen
No,
is
ma'am.
visible for you, ma'am?
No, ma'am. Screen is not visible.
Screen தெரியலீங்களா?
No, ma'am.
ஒரு நிமிஷம். Yes, ma'am. Now, ma'am. Hello, ma'am.
Ma'am, no, ma'am. Not yet visible, ma'am.
இல்ல எனக்கு காட்டுதே ma'am.
It's visible, ma'am.
Visible now, ma'am? Yes.
Visible.
Yes, ma'am. Yes, ma'am. Thank you. Thank you. Shall I start now, ma'am?
Yes, ma'am. Okay.
So, good morning, students. Today, I'm going to speak about recent developments and their research in phytomedicines. I think you know about phytomedicines. They are the herbal medicines which involves the use of plants and their extracts for medicinal purposes. So it is otherwise called as herbal medicine. So we make use of the plants and their extract for medicinal purposes. It is a study and practice of using the natural plant compounds, so which is able to treat, prevent, and manage various health conditions. It combines the traditional knowledge and practices with modern scientific research to understand the therapeutic potential of plants. Recently, there has been a shift, that is from synthetic medicine to herbal medicines. So people nowadays are going for the herbal medicines. So we can say that return to nature. Since many side effects are coming while using the synthetic medicines, now people are going for the natural products. So we can say this word return to nature. So we know that medicinal plants have been known for millennia. So this is highly esteemed all over the world. It is a rich source of medicinal agents. There are so many plants available in our country. So our India, it is known as medicinal garden of world. In India, the system of medicines like Ayurveda, Siddha, Unani, homeopathy, yoga, and naturopathy are being utilized. So the people are going for the Siddha medicine, Ayurveda medicine, Unani, homeopathy, yoga, and as well as naturopathy, which is a five supplements which include all these things, like physiotherapy, occupational therapy, then psychology. Everything will comes under naturopathy. The reason for this popularity of this particular natural product is they are very safe to use, non-toxic, have less side effects, so we can get it in an affordable prices. So for that, people are going to moving from synthetic to herbal medicines. So there are some historical background by the use of these medicinal plants. So we know that the plants, that is the use of plants for medicinal purposes, dates back thousands of years. So that is from ancient civilizations, including the Egyptians, Chinese, Greeks, and Indians, documented the use of herbs in their medical practices. Since we have studied more medicinal plant relevant books from the earlier days itself. Um, Traditional systems of medicine, such as Ayurveda, traditional Chinese medicine TCM, and Unani, have extensive pharmacopoeias of medicinal plants. That is, pharmacopoeias in the sense it is a collection of information about the medicinal plants, its application, that is, the use of the particular medicinal plants, why it has been used, for what purpose it has been used. So it will be present in the books written by some authors. From 19th century onwards, the modern pharmacology began to extract. So that is, the people are going for the synthesis of the extract and synthesizing the phytoconstituents, that is the active component from the plants. That active component is responsible for the therapeutic properties, so which helps in the development of the drugs. So one such example we can say that morphine, so from that is opium poppies, so that is kasakasa, and then quinine from cinchona bark. In Tamil, we will say that as pattai. Then from 20th century onwards, the interest in herbal medicines persisted in various forms, particularly in traditional medicine system and alternative to medicine practices. From 21st century, resurgence of interest in phytomedicine. So that is, there is an increasing use of interest in phytomedicine because that is the awareness of the limitations and the side effects of synthetic drugs have come across by people. So they moved to the phytomedicines. So in the so after the earlier days it was used. So later on the use of that medicinal plant was stopped. So now in the upcoming years, so the resurgence of interest in phytomedicine has came due to increasing awareness of the limitations and the side effects of the synthetic drugs. So for that, the WHO, that is World Health Organization, have recognized importance of traditional medicine and its integration in primary health care. So next, we will see about what are all the phytoconstituents that is present in herbal medicines. So phytoconstituents, they are otherwise called as phytonutrients or even phytochemicals. So they are the active constituents in each and every plant. So while doing our research work, the first thing is after the collection of the plant and preparation of the extract, our first aim is to do the phytochemical analysis. That is, we will see what are all the active constituents present in the medicinal plants. So that active components are responsible or plays a major role in the treatment of many diseases. So such phytoconstituents are present in the medicinal plants, flowers, whole plant, as well as roots, seeds, fruits, leaves, and barks of the plant. So such phytoconstituents are alkaloids, phenolics, flavonoids, tannins, lignins, glycosides, terpenoids, carotenoids, steroids, proteins, and fatty acids. So these are the main active constituents that are found to be present in the extracts of the plants, that is present in the medicinal plants. This may be present in, that is alkaloid may be present in one plant, it may be absent in another plant. It depends upon the species which we are doing. So in one plant, the alkaloid will be the active constituent. In another plant, phenols may be the active constituent. It may differ from each and every species. So we will see the phytoconstituents that are found to be present in the medicinal plants. So in the turmeric, we know that turmeric, uh, it is my phytoconstituent found in turmeric is curcumin, so which comes under polyphenol compound. So it plays major role as anti-inflammatory and the antioxidant property. So the therapeutic effect is anti-inflammatory and the antioxidant activity. So it is involved, its main uses, it is involved in the treatment of arthritis and the cancer. As well as the next is, we know that, so these are the medicinal plants or the herbal medicines which we use in our day-to-day life, in our food supplements. So ginger, the phytoconstituent found to be present is gingerol and shogal. So it is a phenolic compound which is the therapeutic effect of this gingerol is anti-nausea and anti-inflammatory. So it helps in motion sickness and it aids in digestive system, that is digestive aid. So the next herbal plant is garlic, that is allicin S-allyl cysteine. So the organosulfur compound, it comes under the organosulfur compounds. Its therapeutic effect is it has an antimicrobial and a cardioprotective activity. It lowers the cholesterol level and the blood pressure. Next is green tea. The compound present in is epigallocatechin gallate. So it comes under catechin compound. So it has antioxidant and anti-cancer activity. So it helps to weight loss as well as it plays major role in the heart health. Then next, aloe vera. Everyone knows about aloe vera. That is, it is a skincare product. So the compound present in aloe vera is aloin, imodin. So which is a class of anthraquinones. So which plays major role in wound healing and laxative property. So it's used in skincare. So even many home, that is face creams, then lotions, everything consists of aloe vera. So it is used for the skin care and also for digestive system. The next is ginseng. So the compound present is ginsenosides. So which is a triterpenoid and a saponin. Uh, it plays the therapeutic effect of this ginsenosides is adaptogenic immunomodulatory, so which helps in energy booster and it also relieves the stress. Then next plant is milk thistle. The active constituent present in this is silymarin, so which comes under flavonolignans. So the activity is hepatoprotective activity and the antioxidant activity. So it plays major role in liver detoxification and protection process. So liver protection. So since it has hepatoprotective activity, so by consuming this, so we can protect our liver. Then next is echinacea. So cichoric acid, alkaloids. So which comes under polyacetylens and phenolics. So activity is immunostimulating and an antiviral agent. So which examples is cold and flu prevention. Okay, it cures the cold and flu diseases. Then peppermint. So the active constituent found to be present in peppermint is menthol and menthone. So the active constituent, that is which comes under the classes essential oils, so which has antispasmodic and analgesic activity. So which helps in digestive aid and headache relief. Then chamomile. So this consists of the phytoconstituents epigenin, bisabolol, so which is a flavonoid or terpenoid. So that is it helps in that is it has anti-inflammatory and the sedative activity. So which helps in the anxiety and sleep aid. Then next is lavender. The phytoconstituent present in lavender is linalool or linallyl acetate. So, which comes under essential oil. The class of compound is essential oil. So, which has anxiolytic and the sedative activity, therapeutic effect, and the uses is it relieves the stress and give sleep aid. So these are the major phytoconstituents in herbal medicines. So these are the plants or the herbal medicines which we daily have it in our day-to-day life as a food supplementation. So applications in herbal medicines. So we know that these phytoconstituents, they are used in various forms in herbal medicines. So the various forms such as it is used as teas and infusions. So which will be of, that is the extract consists of only water soluble compounds. Then it is used as tinctures and extracts. It is a concentrated form using solvents like alcohol. It can be used as capsules and tablets. So for that, we have to standardize the exact dose of the active compound. Then it is used for the topical application. That is, it can be used as ointments, creams, oils for skin conditions. So inhalation for respiratory purposes and mental health. So essential oils has been used. So these are the different forms of the herbal medicines which we are used by in the form of the phytoconstituents, as we use it as teas and infusions, tinctures and extracts, capsules and tablets, topical applications as ointments, inhalations for respiratory purposes. So, once if we are doing any research work, these phytoconstituents have to be isolated, or it has to be analyzed in the medicinal plants. For this, we have to prepare the that is, we have to prepare the extract. So, this extraction of active compounds from medicinal plants are done by various methods. So, one such method which is done for the extraction of the active compound is maceration. So, maceration in the sense we have to soak the plant material in a solvent, that is water, alcohol, or oil at room temperature for a specific period. So that is maceration process. You are soaking the plant material in any solvent like water, alcohol, or oil at room temperature for a specific period. Then next is extraction method is infusion, similar to making tea. So as such of tea, how we are making tea now in our home, like that only we have to prepare. So that is the plant material has been poured into an hot water and allowed to steep for a short period. So we will get that infusion, that is infused content. Then next process is decoction. So that is involves boiling the plant material in water for an extended period. That is, continuously we have to boil the plant material for a few hours, so that we will get the final lead extracts. If we can directly use the leaves, flowers, so we can boil it in any that is water or any water for an extended period for half an hour or 1 hour or 2 hours. So it depends upon the methodology which we are following. So decoction methods, this is found to be very effective for extracting the compounds from hard plant materials like roots, barks, and seeds. So, roots, barks, and seeds. So, that for the extraction of that bark, root, and seeds, we are preferring this decoction method. So, next is percolation method. So, here the plant material is packed into a percolator and solvent is passed through to extract the active compounds. So we are packing the plant material in a percolator. So the process will take place. After that, the solvent is passed through it to extract the active compounds present in it. So it is used for preparing concentrated extracts and tinctures. So the next method is oxalate extraction. So in our laboratory, we our students will go for this only, the oxalate extraction. So this is the oxalate apparatus. This one is the oxalate apparatus. This last one. It involves the continuous extraction where the solvent is repeatedly cycled through the plant material. One Okay, so in the bowl, we will add the solvent and the plant, that is the extract, will be placed here. Okay, the placed here. So after that, by passage, by continuous heating as well as water flow, the extract will be prepared. So repetitive cycles will be done there for the extraction process. The next process is steam distillation process. Here the plant material is exposed to steam which vaporizes the volatile compounds. The vapor is then condensed back into liquid form. Through the steam distillation process, essential oils will be prepared, like lavender oil, peppermint oil, and eucalyptus oil will be prepared by using this process, that is steam distillation process. So the next methodology that is used for the extraction of the phytoconstituents is ultrasonication process. It uses ultrasonic waves to create bubbles, cavitation bubbles in the solvent that disrupts the plant cell wall and enhance the extraction process. This also done. Then these are all the advanced methodology that is used for the extraction purpose. Then next is microwave assisted extraction. Here microwave energy is used to heat the solvent and the plant material through enhancing the extraction of active compounds in it. So this apparatus, the first apparatus, this one is called as the percolator. Okay, one type of percolator that is used for extraction purpose. So next is enzyme assisted extraction. Here, the specific enzymes have been used to break down the plant cell walls as well as to facilitate the release of active compounds. So we will use the enzymes, the specific enzyme for the particular plant to break down it. After that, the active constituents will be received. Then pressurized liquid extraction method, PLE. So here we use the solvents at high pressure and temperature to extract the compounds from the plant material. So next method, this is the most advanced method, supercritical fluid extraction. Here usually carbon dioxide is used as the solvent. So through which under high pressure and temperature, we are extracting the active compounds. So these are the major methods that is used for the extraction of these phytoconstituents. So that is maceration, infusion, decoction, percolation, oxalate extraction, steam distillation, ultrasonication, then microwave assisted extraction, enzyme assisted extraction, pressurized liquid extraction, supercritical fluid extraction. So these are the different methodologies that have been used for the extraction of the active constituent or the phytoconstituents from the medicinal plants. So next is, uh, so once the that is the phytoconstituents has been synthesized or extracted from the medicinal plants, so we have to formulate that into a novel phytomedicine. So for that, uh, an innovative ways were used to deliver the herbal medicine to be more effectively enhancing their therapeutic benefits and bioavailability. So there is these novel formulation. What it does, no, it represents the advancement in the field of phytomedicine and aimed at maximizing the therapeutic potential of the herbal medicines. So there are many formulation types. So we will see one by one. The first formulation type is, students, is it clear for you till now? Hello? Hello?
Yes, ma'am.
Yes, ma'am.
Okay, okay. So the first formulation type is phytosomes. So that is the phytoconstituents which we are synthesizing now from the herbal extract. It has been complexed with some other agents, some chemical compounds. So that is called as the formulation process. For why we are using this now? For better absorption, we are going with this formulation process. So that phytosomes, in phytosomes, we are using phospholipids. So the complex of herbal extracts have been combined with the phospholipids. So lipid molecules, we know that it enhances the absorption and the bioavailability process. So it improves the absorption process as well as better bioavailability. Example for this phytosomes is silimarin. Silimarin, it is one constituent. It has been binded with the phospholipid. So entirely it is called as silimarin phospholipid complex. And then even curcumin can be binded with the phospholipid complex. That is called as curcumin phytosome. So by making this formulation, um, that is, it enhances the easier absorption and the better availability process. So the next formulation type is nano emulsions. So that is fine oil in water or water in oil emulsion. That is oil in water emulsions or water in oil emulsions. So this will be stabilized by the use of any surfactants. So this nano emulsions, this increased it enhances advantages is it increased solubility, enhanced stability, better delivery to target tissues. So all these things are the advantages of using these nano emulsions. So nano example for this is nano emulsion of turmeric oil for anti-inflammatory effects. So the next formulation type is liposomes. So liposomes, we know that by the name itself, we can say that lipo, that is attachment of the lipid molecule, that is phospholipid bilayer. So this we know that the phospholipid bilayer is found to be present in the cell wall, that is the plasma membrane. That is, it will be of what? That is the head portion and the tail portion. That is water likes and water dislikes. So that spherical vesicle with a phospholipid bilayer that can encapsulate the herbal extracts. So the advantage of using this liposomes is there will be controlled release. It reduces the toxicity. It then targeted delivery. So these are the main advantages of using the liposomes. Example for this is liposomal curcumin and liposomal ginseng. So the next formulation is microspheres. So microspheres are nothing but they are the small spherical particles that can encapsulate bioactive compounds for the controlled release. They are the small particles which can encapsulate bioactive compounds for the controlled release. So advantages: controlled release, it improves the stability process and and helps in the protection. Examples for this is microspheres containing aloe vera, so which can be used for the skin application process. So these are the some of the formulation types that has been used for binding of our active constituent with some chemical compounds. In phytosomes, you are binding the active compound with the phospholipids. In nano emulsions, that is oil in water or water in oil emulsions, that is stabilized with a surfactant. In liposomes, that is the layer is encapsulated, that is phospholipid bilayer encapsulated herbal extract is used. In microspheres, Small spherical particles that has been encapsulated with a bioactive compound has been used. So next formulation is nanoparticles. Nano, we know that it is a nanoscale particles that enhance the delivery of phytoconstituents. So that is nanoparticle in the cells. We can use silver nanoparticle, gold nanoparticle, titanium oxide nanoparticle, zinc oxide nanoparticles. So like that, we can use different nanoparticles for that is, we can bind that. Even biomolecules or biopolymers can also be binded to it to have an enhanced activity. So, which the advantage of this is there will be an enhanced bioavailability process, targeted delivery, then there will be reduced dosage frequency by using the nanoparticles. Even an example for this is nanoparticles loaded with green tea, polyphenols for cancer therapy. Even I did my study, my PhD work, and my major is that is using of that is binding of nanoparticle with any chemical constituent or otherwise with the biopolymers, and after that I will go with the anti-cancer activity or anti-diabetic everything. Then next is solid lipid nanoparticles. Here, the lipid-based nanoparticles have been used. So, lipid-based nanoparticles have been encapsulated with the phytoconstituents. This also have enhanced stability, controlled release, improved bioavailability. And this one, the solid lipid nanoparticles containing resveratrol, it is an a phytoconstituents, uh, so which has antioxidant effect. Okay, then next is the formulation is they are used as hydrogels, as gels we are preparing. It is a three-dimensional polymer network that hold large amount of water and bioactive compounds. We will prepare this as gels. So by using that, there will be a sustained release biocompatibility, which is suitable for topical and oral delivery. This herbal hydrogels has been used for wound healing properties, anti-inflammatory applications. Hydrogels, okay. So mainly, which will be applied as the prepared as the ointments. Hydrogels, they are prepared as ointments for the topical applications. So that is used as for the wound healing properties and the anti-inflammatory properties. So next is transdermal patches. So patches that deliver phytoconstituents through the skin. So sustained release, bypasses first pass metabolism, improved patient compliance. So herbal patches have been used for pain relief, nicotine replacement. So nowadays in the market, uh, we are able to know about many patches. Even there are patches for releasing the toxins. You might have been seen in the social medias that advertisement. So which relieves the complete toxin. So that is prepared by using some medicinal plants. So which takes all the toxic substances that is present in our blood, that is veins. Through veins it sucks all the toxins, substances. So like that, the many patches are available nowadays in our market. The next formulation is oral thin films. So thin films that dissolves in the mouth, it delivers the phytoconstituents directly to the bloodstream. So that is, since we are consuming it, that dissolves in our mouth, that phytoconstituent directly enters in our bloodstream. So there will be a fast onset of action, there will be easy administration, improved bioavailability also. Example for the oral thin films is that is oral thin films of ginger for nausea relief was prepared. Then nano suspensions, that is a colloidal dispersion of phytoconstituents, which increases the solubility process. There will be enhanced absorption. There will be a faster onset of action also. Then one such example for the preparation of that is formulation of nano suspension is quercetin, nano suspension of quercetin for anti-inflammatory effects. So quercetin, it is a flavonoid which is synthesized from the, that is, which has been extracted from the medicinal plants. That quercetin has been formulated in the form of the nano suspension by using submicron colloidal dispersions. So that is used in the anti-inflammatory effects. So the next formulation is phytogelatin capsules. So many capsules have been made from gelatin that encapsulated and protect sensitive phytoconstituents. So which protects from degradation, improved stability, and controlled release. So capsules containing garlic oil for cardiovascular health. This is an example for the phytogelatin capsules. We know that garlic, it is used to, that is, if we consume garlic more, so which helps in the cardiovascular health protection. So that has been, the oil has been extracted from the garlic, and it has been made as the capsule, that is phytogelatin capsule, which helps for the cardiovascular health. Even many oils have been extracted from the seeds, and that has also been prepared as the capsules, like even flaxseed oil, which helps the to lower the cholesterol level. We can say that as also one of the example. Then cyclodextrin complexes, inclusion complexes of phytoconstituents with cyclodextrins to enhance the solubility and the stability process. So it improves the stability, enhanced stability, then controlled release. So cyclodextrin complex of curcumin, it is used for as for anti-cancer activity. So that's all about the formulations. So each and every phytoconstituents has been formulated with any of the chemical compound or a lipid molecule for better absorption and better bioavailability process. So that formulation types are phytosomes, nanoemulsions, liposomes, microspheres, nanoparticles, solid lipid nanoparticles. Then we are preparing as hydrogels for the topical applications. Then we can prepare that as patches, that is for pain relief options. Then we can prepare oral thin films for better activity. Immediate action will take place. And then nano suspensions, phytogelatin capsules, cyclodextrin complexes. So these are the major novel phytomedicine formulations that we come across nowadays. The next, I'm moving with the recent advancements in phytomedicines. So each and every herbal medicine, it is used for treating various ailments, that is diseases. That is, the phytomedicine play a major role in the treatment of cancer. They act as antimicrobial agents. They act as anti-inflammatory and pain management. They are involved in cardiovascular health issues, then neurological disorders, diabetes mellitus, and immunomodulation process. For all these things, there are many recent advancements have been used. So these are the common medicinal plants and their uses which we come across daily. We know that. One such example, I will explain any one or two. Like lemon, we know that it is a liver cleansing agent and it also helps in the digestive process. And then wheat grass, barley grass. So barley grass, when it is rich in chlorophyll and the antioxidants. And milk thistle, as I explained before, it helps in liver support and detoxification process. Then licorice for adrenal stress. Then ginseng for adrenal stress and energy and adaptation. Raspberry, which has antioxidant activity, it acts as the fiber. Then liver and an alkalizing agent. Pomegranate, it is an estrogen balancer and it is an antioxidant. Then dandelion, It helps in the liver support, digestive aid, and detoxification process. Then cinnamon, pattai. So which blood, it balances the blood sugar and the insulin control. Stevia, that is a natural sweetener. So these are the common medicinal plants which we come across day to day life. The first, I will move with the first one. What are all the recent advancements that has been used for the phytomedicine? First one is cancer treatment. Turmeric, that is curcuma longa. It is a curcumin. This is an active compound that is found to be present in turmeric. Shows potential in inhibiting the growth of cancer cells, as well as it helps to reduce the tumor size in various cancers such as breast cancer, prostate cancer, and colorectal cancer. Next is paclitaxel. It is a taxol. uh, this compound has been derived from Pacific yew tree. This also, this compound, it plays a major cornerstone in chemotherapy for the cancers like ovarian, breast cancer, and the lung cancer. So the recent advancements include, so this has been developed in the form of nanoparticle formulation to improve its delivery and reduce the side effects. So I have explained one or two examples only. These are the basic examples. The next is antimicrobial agents. Tea tree oil has been used. So this has major antimicrobial properties. So many recent studies have been focused on its efficacy against antibiotic resistant bacteria, that is methicillin resistant Staphylococcus aureus. Then Manuka honey. So this is also derived from Manuka tree, so which is in New Zealand. This honey has unique antibacterial properties. Recent research has explored its use in wound care and as a potential treatment for chronic wounds and infections. So this manuka honey and tea tree oil has better. They are considered to be the better antimicrobial agents, where many recent studies have been done on it. Then anti-inflammatory and the pain management. Phyllobark tree, that is, it is a precursor to aspirin. It is studied for it. It relieves the pain as well as it has anti-inflammatory properties. So recent formulation shows that it reduces the gastrointestinal side effects associated with the traditional non-steroidal anti-inflammatory drugs. Next is cannabis. The use of this cannabinoids. So it is an active constituent, that is cannabidiol or tetrahydrocannabinol. Uh, they helps to manage the chronic pain, inflammations, and conditions like multiple sclerosis and epilepsy. So these one, willow bark and cannabis, these are used as the anti-inflammatory and pain management. For cardiovascular health, Ginkgo biloba. So this has been used for improving the circulation and the cognitive function. Recent studies suggest that Ginkgo biloba may help in preventing cardiovascular diseases by reducing the blood clotting and improves the blood flow. Even the flaxseed oil, as I said before, that also lowers the blood cholesterol level. It maintains the bad cholesterol level in our body and helps in the continuous circulation of the blood in our veins. Next is garlic, Allium sativum. That is, recent research highlights garlic's potential in lowering blood pressure, cholesterol levels, and preventing atherosclerosis due to its antioxidant and the anti-inflammatory properties. Next is neurological disorders. Ginseng, the active constituent present is ginsenosides. This helps in the neuroprotective effect. So it is potential in benefiting the conditions like Alzheimer's disease and improving cognitive function. Next is St. John's wort, commonly used for the depression. Recent research is investigating its potential for treating other neurological disorders such as anxiety and sleep disorders. Next, the disease is diabetes management. Bitter melon. This plant has been shown to have hypoglycemic effect. Hypoglycemic effect helping to lower the blood sugar level in the diabetic patients. So it lowers the blood sugar level in the diabetic patients. Recent studies are exploring that. They are studying the mechanism and the potential as a complementary therapy for diabetes. So what are they are going with the mechanisms behind the study. Then fenugreek, known for its anti-diabetic properties. We know that the old people, they will uh, eat this fenugreek seeds. That is, they will soak it in water overnight and have it in the empty stomach in the early morning. So that also gives a better curative for the diabetes. So recent research focus on its ability to improve insulin sensitivity and reduce the blood glucose level. Now the researchers are going with the mechanisms, in what stage it exists, how we can block it, how it can be reduced. Everything the researchers are being studied. Next is immunomodulation, echinacea. This is used to boost our immune system. Recent studies are examining its potential to modulate immune responses and its effectiveness in preventing and treating the respiratory infections. Astragalus, research is ongoing on its immunomodulatory effect, particularly in enhancing the immune function and its potential role in cancer therapy as an adjunct treatment. So these are the main recent advancements that has been done in the phytomedicines, that is the herbal medicines. Next, after that, we have to go with the clinical trials involving these phytomedicines. These trials, what it does know, it cover a range of health conditions and demonstrates the potential use of phytomedicines both in complementary as the alternative medicine. I have mentioned a few notable recent clinical trials which has been done. One such clinical trial done is curcumin for inflammatory disease. So the scientists have studied a randomized double-blind placebo-controlled trial investigated the effects of curcumin, so which is an active component of turmeric. So this study has been done on patients with osteoarthritis. So from their study, they found that curcumin significantly reduced the pain as well as improved physical function compared to the placebo group, suggesting its potential as a natural inflammatory agent. So this study was published in Journal of Clinical Rheumatology by the year 2023. So curcumin, it is used for inflammatory diseases also. So next study is by using ashwagandha for stress and anxiety. Here also a randomized double-blind placebo-controlled trial was done to evaluate the efficacy of ashwagandha root extract in reducing the stress and anxiety in adults. So from their findings, participants receiving ashwagandha reported significantly lower levels of stress and anxiety compared to the placebo group, supporting its traditional use as an adaptogen. This is also published in Phytomedicine by the year 2023. So, ashwagandha for stress and anxiety. Next, echinacea for upper respiratory infections. This also a multi-centered study, a randomized double-blind placebo-controlled trial, which has been assessed to assess the effect of echinacea on the prevention and treatment of upper respiratory tract infections. From their study, the author found that the trial indicated that echinacea reduced the incidence and duration of the upper respiratory infections, thereby highlighting the potential as an immune modulating agent. So this study was also been published. Then ginkgo biloba for cognitive decline. So here also a randomized placebo-controlled trial explored the impact of ginkgo biloba extract on cognitive decline in older adults with mild cognitive impairment. Here, the author found that from their results, it was shown that the particular plant supplementation improves the cognitive function, thereby slowing the progression of the cognitive decline compared to the placebo group. So this ginkgo biloba that is used for cognitive decline. It was proved and published in Alzheimer's Research and Therapy. Then green tea extract for weight management. Here also the researcher has done a randomized double-blind placebo-controlled trial examining the effects of green tea extract for weight loss and metabolic health in overweight and obese individuals. So based on their study, it was found that green tea extract significantly promoted weight loss and improved metabolic parameters such as lipid profiles and insulin sensitivity. This study was also been published. Then milk thistle for liver health. A randomized double-blind placebo-controlled trial investigated that hepatoprotective effect of milk thistle extract in patients with non-alcoholic fatty liver disease. From their findings, it was found that participants taking this particular plant, milk thistle, showed significant improvements in liver enzymes and markers of liver inflammation compared to the placebo group. Next is saw palmetto for benign prostatic hyperplasia. So, here also a randomized placebo-controlled trial assessed the efficacy of saw palmetto extract in men with benign prostatic hyperplasia. So, this trial demonstrated that the extract significantly improved the urinary symptoms and quality of life in patients with BPH. Next, ginger for nausea and vomiting. Here also, a randomized double-blind placebo-controlled trial was done to evaluate the effect of ginger root extract on nausea and vomiting in pregnant women. The study found that ginger reduced the severity of nausea and frequency of vomiting compared to the placebo group, supporting its use as an antiemetic. So, which helps for the pregnant women. Then garlic for cardiovascular health. See, a randomized double-blind placebo-controlled trial explored the impact of garlic extract on blood pressure and lipid levels in patients with hypertension. The results indicated that garlic extract significantly lowered the blood pressure and improved the lipid profiles, suggesting cardiovascular benefits. So, it has been proved that garlic is used for cardiovascular health. So, which helps in lowering the blood pressure and improves the lipid profile. Aloe vera for skin conditions. Here also a double-blind placebo-controlled trial was done to check the efficacy of the topical aloe vera gel in patients with psoriasis. Uh, that is, the trial showed that by the use of this aloe vera gel, it reduces the psoriasis severity and it improves the skin hydration compared to the placebo. So this was also published in the dermatology journal by the year 2022. So by studying these clinical trials, which helps to underscore the importance of rigorous scientific research in validating the therapeutic potential of phytomedicines. So, based on these evidences only, we can say that these phytomedicines they have a therapeutic potential. So, they provide evidence for their use in various health conditions supporting their integration into mainstream healthcare practices. So, after doing the clinical trials, the next most important thing is we have to monitor the quality control aspects. So, that is each and every phytomedicine which involves using the plant deriving substance for therapeutic purposes is increasingly popular due to its perceived safety, then as well as efficacy, as well as its holistic approach. However, by ensuring the quality, safety, and efficacy of phytomedicines poses unique challenges. So, for this purpose, regulatory and quality control aspects are crucial to address all these challenges. Okay, so for that, we have to go with the quality control aspects also. We have raw material quality, contaminant testing, stability and shelf life, batch to batch consistency, then good agricultural and collection practices. So these quality control aspects has to be followed. So first one is raw material quality. So each and every medicinal plant which we are studying, no, that it should be of authenticated by a person. That is, it should be authenticated by botanical identification. So we have to choose the correct plant species. That is very, very important. So once if we are going with the research work, that is if we are choosing any medicinal plant, that has to be authenticated by any persons, authenticated persons. We used to get the authentication from Tamil Nadu Agricultural University, TNAU. Likewise, each and every persons, those who do research works in medicinal plants, they have to check whether the plant that we are using it is found to be correct or not. It should be authenticated. So they will do the morphological examination, chemical profiling, and the DNA barcoding also. Then we have to standardize that. It should be standardized to contain consistent levels of active compounds. That is, we have to compare with the reference standards. Then only we can proceed with our findings. Next is contaminant testings. So we know that nowadays pesticides, heavy metals, and microbial contaminants are there. So the testing for contaminants is essential to ensure the safety of phytomedicines. So contaminant level must be within acceptable limits as said by the regulatory authorities. Okay. So we should not use the contaminant sample or the phytomedicine for doing our research work. It should be tested. It should be, the contaminant level should be minimum, that is it should be within an acceptable limit only. Next is stability and the shelf life. Phytomedicine should undergo stability testing to determine their shelf life and ensure whether they remain effective and safe over time or not. Then as well as packaging, appropriate packaging material should be used to protect the phytomedicines from environmental factors such as light, moisture, and air. Next is batch to batch consistency. Quality control test has to be performed, including the assays for active ingredients, dissolution testing, and microbial testing are conducted to ensure batch to batch consistency. So the quality control test has to be performed. So next aspect is good agricultural and collection practices. Sustainable sourcing. So there is GACP guidelines to promote the sustainable and ethical sourcing of plant material, ensuring that they are collected in a way that does not harm the environment for local communities. So those are the major quality control aspects that has to be checked before performing our analysis. The next is regulatory aspects. The regulatory aspects. has to be based on legislation and guidelines. It should be with registration and approval, labeling and claims. Legislation and guideline. National, it should be followed with the national and international regulations. We know that different countries have specific regulations governing the approval, manufacture and sale of the phytomedicines. For example, we can say that in USA, the FDA regulates phytomedicines under the Dietary Supplement Health and Education Act, that is DSHEA. The European Union, the European Medicines Agency, provides guidelines. So each and every phytomedicines in different countries, they should be it should be governed with the proper approval before manufacturing. Then good manufacturing practice. Compliance with GMP is essential to ensure the consistent quality and safety of the phytomedicines. It is very, very important to ensure the quality and the safety of the phytomedicines. This GMP guidelines cover all aspects of production from raw material sourcing, from the raw material for the production to final product packaging. So we have to follow as per this GMP guidelines. Next, registration and approval. So before proceeding for the preparation of any drug, we have to do the preclinical and clinical studies. So phytomedicines has to undergo rigorous testing, including the preclinical studies in vitro, as well as by using the in vivo methods, by using any animal studies, and the clinical trials to demonstrate their safety and efficacy. Then traditional use registration. In some jurisdictions, traditional use registration pathways allow for the approval of phytomedicines based on their long history of use and documented safety. Then the next regulatory aspect is labeling and claims. So truthful labeling should be there. That is, regulatory bodies require accurate labeling of phytomedicines, including the informations on the ingredients, dosage, contradictions, and as well as the potential side effects. So the truthful labeling should be there. It should be of very accurate. So before labeling the phytomedicines. Then health claims. Any health claims made about the product must be substantiated by scientific evidence. So it will be misleading or unsupported claims are prohibited. So these are the major regular aspects that has to be followed before proceeding with the formulation of any drug. So conclusion, phytomedicine, it bridges the gap between the traditional healing practice as well as modern medical science. It offers a holistic approach to health and wellness, emphasizing the use of natural remedies to support as well as to enhance the body own healing process. With a growing interest in natural and complementary therapy, phytomedicines continues to be a vital area of research and clinical practice. So this phytomedicine, it generally bridges the gap between the traditional healing practices and modern medical science. It is an approach to health and wellness which emphasizes the use of natural remedies. So these are the challenges and future direction. The main thing is quality control. We have to ensure the purity and the potency of the herbal products, as well as regulation. That is also very, very important. Varying regulatory standards across the countries can affect the safety and efficacy of herbal medicines. Then research and development. Continued research is needed to fully understand the mechanism of action, interactions, as well as the potential side effects of the phytomedicines. Thank you.
Dear participants, if you have any queries, feel free to ask.
Ma'am, good morning.
Good morning, ma'am.
Ma'am, I want to ask which oil do you use for the extraction of materials? Because I have never used any oil and I have never heard of any oil. We use ethanol, alcohol, or this chloroform for the extraction
Ah,
of materials.
ma'am, ma'am, will you please tell ask again, ma'am? I can't understand what you're.
Ma'am, you have said
Hello.
that in Soxlate
Ah,
for the extraction of this phytomedicine or for the extraction of
ah,
the secondary metabolites, we use
yes,
different types of organic liquids,
solvents. Yes.
solvents like chloroform I have used. Then
Ah,
usually we use ethanol or chloroform mostly.
yes.
But I have never heard of any oil, ma'am. I want to know the name of that oil.
Essential oils are used, ma'am. Uh, for the oxalate, even this eucalyptus oil. So that is volatile oil, volatile acid oil has been used.
Okay, ma'am. Okay. Thank you, ma'am.
Okay, ma'am.
Good morning to one and all. It's my privilege to propose a vote of thanks on this occasion. No one who achieves success does it without the help of others. The wise and confident acknowledge this help with gratitude. As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. I would like to extend a word of thanks to all our presenters, organizers, and attendees for making this webinar a great success. Your contributions and participation have made this event successful. I would like to thank our presenter for sharing her knowledge and expertise with us today, Dr. Rajathi Madam, for not only sparing their invaluable time for us to grace the occasion, but also for enlightening us with their commendable talk on the subject. Your participation and engagement have made this a truly interactive and collaborative experience, ma'am. Finally, I would like to thank all the participants. Thank you.
Thank you, ma'am. So I take this opportunity to thank all the students who were patient for all over the 1 hour, and I thank the coordinator as well as the director for giving me this opportunity to present the topic based on the phytomedicines. So thank you all. Thank you, ma'am. Thank you, Rekha, ma'am.
Thank you, ma'am.
Okay.
Really
Shall I
a
quit?
fruitful session, ma'am.
Yes, yes, ma'am. Tell.
Yes, ma'am.
Yes, ma'am. ஏதோ சொன்னீங்க, ma'am.
Ma'am, really it's a fruitful session, ma'am.
Okay, thank
Given
you
in
so
an
much, ma'am.
understandable way, ma'am. Given in an
Oh,
understandable way, ma'am. Really. Thank you, ma'am.
oh, thank you, ma'am. Thank you so much, ma'am. Thank you, students. Thank you.